Hi, I'm Dr. Steve Schlozman. I'm a child psychiatrist and a consultant with the New York State Project Teach program. Today, I'd like to talk with you about your teenager's mental and emotional health. Remember, your primary care physician is trained and ready to answer your questions about this complicated time in your child's life. But the typical teen isn't as likely as younger kids to voice their concerns directly to parents. At the end of the day, it's important to remember that even though you might feel like your teenager is more and more distant, you still know your child best. But the outside world plays a much greater role in shaping your child's personality and health. Challenges such as sleep disturbances, disordered eating, depression, and drug and alcohol use can also begin during these vulnerable years. All of this means that the questions you bring to your doctor will be a combination of your unique understanding of your teen, worries that your teen may have directly voiced to you or to friends and mentors, and the concerns that your doctor will bring to the visit as well. It's obviously daunting to ask all of these questions before the visit. These kinds of issues are best addressed continuously and over time. Many parents worry that teens aren't listening when they ask these types of questions. But all sorts of evidence suggests that teens listen carefully to their parents, even when they do their best to appear like they aren't listening at all. So even if he or she doesn't answer you directly or even make decent eye contact, you should know that you've planted the seeds for further inquiry. Having said that, it also makes sense to prepare specifically for your teen's yearly doctor appointment in order to make sure that these issues are on your child's mind and brought to your doctor's attention. Start in an open-ended fashion, and then narrow your inquiries if your children seem interested in elaborating. Talk directly to your adolescent. Avoid using euphemisms or being vague. This is the best way to make sure you're both talking about the same thing. With all of this in mind, important questions include: do you have any concerns you'd like to discuss with your doctor? Do you have any concerns that you'd like me to discuss with your doctor? Remember that unless what you tell your doctor seems really dangerous, your conversation at your checkup will be confidential. Your doctor may ask about school. Are things going okay at school? Are any subjects particularly hard? Are there any teachers who are more difficult? Why? The doctor may want to hear about your friendships and the kinds of activities you're involved in, like sports and even social media. He or she will probably address bullying. Do you ever feel bullied? Your doctor will probably ask you about drugs or alcohol. You'll get to talk about this without me in the room. Even so, I want to check in with you to see if you have any questions for me. I'm also pretty sure your doctor will want to talk to you about sex, including birth control and sexually transmitted diseases. Are there questions you have for me? From these general questions, you can start to gently inquire about some of the symptoms of emotional distress that can start during this time. For example, how are your eating habits? How do you feel about the way you look? How do you feel about yourself? Are you happy? What's interesting to you these days? How's your sleep? When do you go to sleep? Is it hard to wake up? How much coffee or energy drinks are you consuming? Do you have any worries? What do you worry about? Do you ever wish you weren't alive? Do you have thoughts of hurting or killing yourself? Have you ever hurt yourself? If your child answers any of these questions in ways that worry you, contact your doctor immediately. It's always better to seek reassurance than to be sorry that you didn't check in. Finally, there are questions that some parents will find more novel. These include checking in around gender and sexual orientation. Although these issues are discussed more openly even than they were a decade ago, it's still important to begin these discussions gently but directly. For example, have you had thoughts or concerns about your sexuality? Do you think you're straight or gay? Are you still figuring that out? Do you identify with your gender? Do you think of yourself as a boy or as a girl? Do you want to talk to your doctor about these matters? Is there anything else you'd like me to ask? Many parents and teens have an understandable amount of anxiety around these kinds of questions. Just be straightforward, and if you have any concerns at all as you prepare for this visit, always remember that you can check in with your doctor. These are fun years, but they can be quite a ride. Just hold on, and enjoy them.